Hello, everyone. Sudhakar, physiotherapist here. I'm very excited to meet you guys again. And last week, I was talking to one of my like a junior, and he's graduating very soon from physio school. And he was very confused, like he's going to come out of school, and then he don't know. He has learned a lot of different approaches in school, and he has heard from his friend that there are a lot more to learn, and he was confused what kind of approach to use, what works the best, and he asked me to help him with that. Then I said that, like, in my last 16 years of practice, the best approach that has helped my clients is a combination approach. I will explain what a combination approach is. But after using the combination approach, my success rate went from like 25% to above 90%, and the satisfaction rate went above 98%. And I explained him about this combination approach, how it works, and he was very excited. And I thought I will share the information with you guys. Probably, if you have any joint or back issue, maybe this can help you. Okay, so the combination approach. Let me share my screen. Okay, it's a four-stage program. When you come into the office, we take a detailed history. So this detailed history will let us know um, what could be the possible cause of your problem, and we form a hypothesis, and we prove the hypothesis with a couple of special tests. We may ask you to do certain repeated movements, maintain certain position, uh, and do some special tests to find out what could be uh, the cause of your problem. And once we come with the diagnosis, then the stage one again, if you have a lot of inflammation, pain and inflammation, then we use a class 4 laser therapy. We are one of the very few clinics to offer this technique. Amazing modality. It brings down the inflammation, and most of the client, they see reduction in their pain more than 90% of the time, and their range of motion also improves. When they have a lot of inflammation and pain, this helps quite a bit. And let's say if we found that your joints are not moving as it's supposed to move. Here in the picture, you see only the lower back, but we also help with other joints, including shoulder. So we'll check your joint and see how it is moving. And if it's not moving as it's supposed to move, then we use this hands-on approach to loosen the joints. Okay. And most of the time, when you have trouble with the joint, then there will be trouble with the muscles too. So we use the shockwave therapy to release the muscle knots. That in turn can help with your pain and improve your range of motion. And again, a fantastic modality. It's like a revolution. Like like most of the clients, they get improvement in their pain and improvement in the range of motion instantly. Okay, that's what I like about this shockwave therapy. And we also use dry needling or acupuncture, if like to release the muscle knots in the muscle that are too deep. If we can't reach with other techniques, then we use acupuncture or dry needling to release it. So with all this combination approach, instead of using going with just one technique, with this combination approach, we get the best result. The pain comes down and the range of motion improves. But now we don't want to discharge the client at that point, because then this thing is going to becomes more like a band-aid solution. We don't want that. So what we do is, the next step is very important. We move on to stage 2, where we work on like deeper core muscles. If it is the lower back, it'll be the core muscles like transverse abdominis and all those core muscles. If it is shoulder, it will be your rotator cuff muscles, shoulder blade muscles. Like that, we with each and every joint we have like a deeper muscles. We work on that, work on strengthening them. Okay, then we move on to strengthening the larger muscle group. Okay, again to give stability. Okay, also we use a fascia train technique. That way the strengthening is lot faster, um, rather than working on individual muscles. Okay, once that's done, this is stage 3. And once stage 3 is done, many times I've seen uh, therapists, they miss training on return to work or return to sports conditioning. So what happens when they go back to work or sports or day-to-day activity? They get re-injured. We don't want that, right? So that's why we have a work or sports conditioning towards the stage 4. That way, we train you on your work or sports, so that when you go back to work or sports, you don't get re-injured. Okay, this 4 stage process is fantastic. That's what I've seen. Like, we got like more than 98% satisfaction rate. Okay, and if you have any questions about your joint or back pain, please put in the like direct message me, and I'm more than happy to answer your questions. Okay, thank you.